Hey guys, welcome to my 10. So in this video we are going to learn about the anatomy of the tongue. So basically this is going to be introduction. We are going to learn the parts of the tongue, the dorsal surface of the tongue as well as the ventral surface of the tongue. So please stick to the video till the end and make sure you subscribe the channel. So moving on to the anatomy of the tongue. So the tongue is a mobile muscular organ, and the midline fibrous septum, it separates the tongue into the right and the left halves. So the tongue is a mobile muscular organ, and the midline fibrous septum, it separates the tongue into the right and the left halves. So what are the functions of the tongue? We know the tongue is used for the taste, speech, mastication and deglutition. So four important functions of the tongue are taste, speech, mastication and deglutition. And what is the shape of the tongue? The shape of the tongue is conical in shape. So basically the root of the tongue is a little bit thicker, and as it extends forwards up to the tip, it's going to get narrower. So the shape of the tongue is conical in shape. So what are the external features of the tongue? As I told you, the tongue has a body, a tip and a root. A body, a tip and a root. The root is attached to the mandible. The tip is a free anterior end, which you can see, and body is the bulk of the tongue. So external features: the tongue is a root, a tip and a body. The root is attached to the mandible, tip is the anterior free end, and body is the bulk of the tongue. So these are the external features of the tongue. Now moving on to the dorsal surface of the tongue. What are all the important landmarks that you can see in the dorsal surface of the tongue? The tongue is divided into the anterior two-third part, which is the oral part, and we have the posterior one-third, which is the pharyngeal part. The anterior two-third is forming the oral part. The posterior one-third is forming the pharyngeal part of the tongue. In the anterior two-third, we have four types of papillae, which are used for the taste sensation. What are all the four papillae? We have the valate papillae, the foliate papillae, the fungiform papillae, and the filiform papillae. So these papillae are used for the taste sensations: valate papillae, foliate papillae, fungiform papillae, as well as the filiform papillae. So this forms the anterior two-third of the tongue. And what differentiates the anterior two-third and posterior one-third of the tongue? We have the sulcus terminalis. Sulcus terminalis, and you can see one point here that is called as the foramen cecum. So this differentiates the tongue into anterior two-third and posterior one-third. So what do we have in the posterior one-third? That is the pharyngeal part of the tongue. We can see some of the lymphoid follicles on the posterior one-third, and lateral to the posterior one-third we can see palatine tonsils, and in front of the palatine tonsils we have the anterior pillar formed by the palatoglossal. It is also called as the palatoglossal fold, formed by the palatoglossus muscle. So when you go again posterior to the posterior one-third, we can see lateral glossoepiglottic folds, vallicula, as well as the epiglottis. So this completely forms the dorsal surface of the tongue. Again I am going to revise. We have the anterior two-third, posterior one-third, and again behind it, anterior two-third is formed by the four types of papillae: valate, foliate, fungiform and filiform. It is differentiated by the sulcus terminalis and the foramen cecum. Posterior one-third of pharyngeal part has the lymphoid follicles, and lateral to it we have the palatine tonsil and the palatoglossal fold, and again posterior to it we have the lateral glossoepiglottic fold, vallicula and epiglottis. So this completely forms the dorsal surface of the tongue. Now moving on to the ventral surface of the tongue. What do we have on the ventral surface? When you elevate the tongue, what you can see on the ventral surface? On the ventral surface you can see a frenulum linguae. Ventral surface you can see in the midline frenulum linguae, and at the lower end of the frenulum linguae, at the lower end of the frenulum, you can also see opening of the submandibular ducts. And again lateral to it, what you can see openings of the sublingual glands, and also you can see sublingual fold which is overlying the sublingual gland. So what we can see in the ventral surface of the tongue? We can see frenulum linguae, lower end of the frenulum, openings of the ducts of the sublingual gland, openings of the submandibular ducts, and as well as the sublingual folds overlying the sublingual gland. So this is about the ventral surface of the tongue. And some of the clinical anatomy that you should know, and it is also important for your university exams to write, something called as the tongue tie. So what is tongue tie? When the frenulum extends too far towards the tip of the tongue. So actually the frenulum is attached a little bit backwards, right, towards the root. So when it comes too forward towards the tip of the tongue, that is called as the tongue tie. The second important clinical anatomy is that there are some drugs which are lipid soluble drugs, and they are directly absorbed from the sublingual region. Example is the nitroglycerin. So this is taken during an angina attack, and you just take the tablet, put it in your mouth, and within a minute it dissolves into the sublingual region to reach the systemic veins. Then the third important point is the carcinoma of the tongue. So most probably carcinoma of the tongue arises in the anterior two-third of the tongue, and most probably the lateral margins of the tongue. So this is about the some important clinical anatomy that you should know. And thank you for watching. The tongue anatomy will be continued, so make sure you watch the entire anatomy of the tongue. And thank you for watching till video till the end. Make sure to subscribe and hit the like button, and also share it to other friends if you found this helpful. Thank you so much, and I'll see you in the next video. Bye.